right. What is the most appropriate next step in the management of this patient? 62-year-old man presents to clinic with a 3-month history of intermittent right flank pain. He has a history of smoking and hypertension. Abdominal CT scan reveals 4-centimeter renal mass with thickened irregular walls, multiple septations and focal calcifications in the right kidney. No solid components are observed. Again, most appropriate next step. So let's see. Intermittent right thing, smoking, hypertension, thickened irregular wall, focal calcifications. I'm really thinking cancer. Okay. But we don't know. So next step. So that's why I don't know if nephrectomy is the next step. I wouldn't wait 6 more months because he does have the hypertension. I don't I I don't know if ablation is a thing in the kidney. I'm sure it is, but I don't know if it is. Um, Initiation of an ARB. I don't think there's too much information. I mean, hypertension, he does have hypertension. Um, but he has that 4-centimeter renal mass. I would biopsy the mass.
100%, right?
Okay.
This is
Yep.
highly, highly suspicious for cancer, right? three
Yes.
month history, pain, older person,
Calcifications.
smoker,
Yep.
hypertension, four-centimeter mass that is just really irregular looking, has calcifications, which is never good, right? So yeah, you want to biopsy them, to either confirm or deny that it's cancer. Once you figure it out, if it's renal cell carcinoma, then you have to figure out, okay, do you want to cut it out, right? But you
Right.
can't really cut out a whole kidney without a pathological diagnosis. So,
Okay. And kidney is one of the tissues that you biopsy, isn't it? Like, because, right, like testes, you don't biopsy. I'm wondering else what other things I like. Do you not biopsy? Do you
oh,
biopsy brain, or is it like is
yeah.
there a
So,
rule with this?
so it just depends, right? Like, you know, I'm going to give you broad things, right? I'm
Okay.
trying not to kind of limit you, but, things that are very vascular in origin, right? You don't want to biopsy, right? Like,
Okay.
you know, um,
Like the eye, right? You're not going to biopsy an eye.
No, you're not really gonna biopsy the eye, but you can biopsy things around the eye, right? But I'm
Okay.
saying what I mean by vascular is like, let's say you see a tumor that's highly vascular. If you biopsied it, it's gonna probably like bleed like stank.
Okay.
So you're gonna kind of avoid, like, for instance, like AV malformations. You don't want to biopsy those; those will bleed, right?
Okay.
You don't want to biopsy a juvenile nasal angiofibroma in the clinic because that'll bleed, right?
Okay.
So things that that's why vascular tumors and things like that. A lot of times you can diagnose with MRI imaging with contrast,
Okay.
because they have very distinct characteristics, right? So for instance, giving you examples like a carotid body tumor, which is like that is in between the kind of where the external and internal carotid where it sits, right? So
Mm-hmm.
you don't want to shove a 20 gauge
A
needle in
needle.
the
Okay.
carotid and it just fucking bleeds like crazy, right?
Oops. Yeah.
Like, not be good. You know what I'm trying to say? Like, so
Yes.
imaging will be like, oh, that's like 99% that is probably a carotid body tumor. So why do you want to stick a needle in there? You know what I mean?
Right.
But
Right.
the kidney, right, and cancers and things like that, like, as long as it's not vascular, no one is ever gonna be like, why would you biopsy that with a needle? No one's gonna
Okay.
fault you, right?
Okay.
So if you think it's cancer, right, and they don't say like, oh yeah, I mean, they're never gonna test you like this because that's like very specific for cancers. But if it's on a test on step two, if you think it's cancer, before you can do any surgery, you need to biopsy it. So
Okay.
so
Just as
always
a general idea. It's just
general
like, yeah.
rule. Yeah,
Okay.
general rule, because it changes your manage significantly, right? Because give
Okay.
you an example, right? Let's say you biopsy this thing and it comes back as benign,
Mm-hmm.
right? It comes back as benign. So then the management can be different, right? You can tell the patient this is benign. If it grows, right, it just causes like local area issues, but it's not
Okay.
cancer. So you
Okay.
can wait, right? You're not rushing surgery. If it's cancer, then you're like, well, we would rather do this sooner rather than later because cancer will grow, spread, right? Can be
Okay.
bad, right? But you see the conversation is very different, right, from what the path result is.
Okay.
So
Makes sense.